Good morning, and thanks Broward Health for hosting us here today. It's great to be back, joined with the Surgeon General of Florida, Dr. Joe Ladapo. We also have Kevin Guthrie, our Division of Emergency Management Head, Secretary Simone Marsteller for the Agency of Healthcare Administration. Of course, we have the CEO here, Shane Strum. We also have Dr. Joshua Lenchis, who's the Regional Chief Medical Officer for Broward Health. We have Representatives Lamarca, Fabricio, and Barrero. Mayor Mike Udine from Broward County. I want to thank him for being here as well. Last week, I think many of you know, we were concerned about what was happening with taking back of the supply, even more so than has been, of monoclonal antibodies. The federal government had stopped sending both Regeneron and the Eli Lilly monoclonal, and that was based off some preliminary studies saying that it may not be as effective against Omicron, but of course Omicron's not the only variant that's out there, and it's something that we actually have seen applied with Omicron patients, and we have seen symptoms resolved. So it's not clear that this is not something that is going to not be a benefit. It may not be as good as it was against Delta, but we obviously want to have that here for patients to be able to do it. And so we, under Dr. Ladapo's leadership, we push back against that. We feel there's no need for it to just be sitting on the shelves. We asked them to stop preventing the distribution of these treatments. And fortunately, yesterday, HHS decided to reverse course, and they are going to be sending these treatments. I think that's the right thing to do. And we're past the point now where we're able to get it directly from any of these companies. The federal government has cornered the entire market. They basically took control of the supply in September. We had done a deal with GlaxoSmithKline on the Sotrovimab, which a lot of people think is the most effective against Omicron, and that is no longer a possibility because the feds have an exclusive arrangement. So we have been able to see, though, enough data, both from South Africa, Europe, and now here in the United States, to know, fortunately, that Omicron is far less pathogenic than the Delta variant was. It's characterized more as mild and brief symptoms in the upper respiratory region, and an absence generally of pulmonary symptoms, which really was what made Delta so devastating. But we also know that Omicron spreads far, far more rapidly. I think if you look around the world, any place that has had Omicron in significant numbers, you don't really have a slope. You have like a straight line going up in terms of how quickly it spreads. And I think we've also seen with Omicron, the vaccinations are not preventing infection. Miami-Dade, for example, is one of the most vaccinated places in the country, if not the world, and they've had huge Omicron infections. And so that's just the reality in terms of that this thing is spread very, very rapidly. There's indications and some studies out of South Africa that an Omicron infection may generate immunity against the Delta variant. And that's important because, yes, in Florida, particularly South Florida, we do believe it's overwhelmingly Omicron infections that are occurring, but Delta is still there, and most of the people that get really seriously ill are still being infected with the Delta variant. And so it's important to understand that and be able to have a strategy in place that is going to deal with both of those. And so we're able to be able to say today, now that we've gotten the pathway cleared with the Regeneron, now that we've gotten the pathway cleared with the Bamlanivimab, and of course we want more and more of the Sotrovimab to do, we have the ability, and we will immediately turn on additional sites as soon as the federal government gives us a supply. We will do an additional site here in Broward County. We'll do an additional site in Miami-Dade. We'll do an additional site in Palm Beach County. We'll do an additional site in Central Florida. And we also have the capacity to increase of the existing footprint, which we do have a good existing footprint. And we have the ability to add 5 to 10 more sites as the demand may be. But that is all contingent on the federal government sending the doses that we need. And so we're looking at probably between 30 and 40,000 additional doses. This will be used very easily. We've got the infrastructure in place. After we did our sites over the summer, once the demand declined, we were able to effectively mobilize them within each community. So there's some places where the hospitals take the lead. There's others where sites are run, and it's a variety, but people have had access on that. But we also knew that if there were increases in the future, we wanted to make sure that we had the capacity to be able to ramp up very quickly. And so those sites will be up the next day. They're ready. We have DEM, we have health. It's all locked and loaded. It's just a matter of federal government giving us more doses to be able to administer for the Floridians who need it. So that will make a positive difference. And we also had the foresight to ask the legislature in October to set aside money so that we would be able to handle this and there'd be no issue with it, including purchasing our own supply. I don't think we have the option to do that in terms of the federal government's exclusive arrangement, but if they were willing to sell it, we have the ability to buy it ourselves. So that's close to $1 billion that's been set aside to mobilize to be able to treat people, and we're glad that we were able to do that. We also are looking, if you look at the Jackson down in Miami, the biggest system down in our biggest county, they have been putting out data distinguishing the people that are COVID positive in the hospital for something else and the people that are actually being treated for COVID. I think that's an important distinction to make when you have a variant like Omicron, which is much more widespread. You are going to have people who get into a car accident, go into the emergency room, they're swabbing everybody, and you're going to have people that have incidental positives. And so they've anticipated about half of their COVID positive patients within their system are not being treated for COVID. And I think you're likely to see bigger percentages in that regard than we've seen throughout the pandemic. And so that's important when you look, right now in Florida, we've seen increases, but we still have, I think our ICU COVID utilization is the lowest per capita in the country. Right now it has gone up like everything has since November, but looking to see who is being admitted for COVID versus who may be admitted with COVID is going to be important to really chart the severity of what we're seeing. And we do think the most severe cases are still the Delta variant. In terms of, we were talking with the mayor about there's obviously a crunch on the availability of tests. We were promised a lot of these home tests. That's the federal government has total control over that. They've promised hundreds of millions of tests. I don't know when that's coming, if it'll come. Sending it to people or letting them do that without having to go into a line would probably be the most efficient way to do it. If we had the capacity to buy some, we would have bought some, but we can't. It's all going to be done through the federal government. And so I know that there's been promises made in that regard, and so we will see. We have pushed out from the Department of Emergency Management in the last 6 months over 1,500 requests for tests. We've done 50 in Broward County. Now, because of the limited supply, what's asked for, you got to look to figure out, try to spread it around as best you can, and that's what Kevin has done. So there is a crunch on this, and that's just going to be the reality until we get the federal government to start sending more down. But in the meantime, Dr. Latipo is working on providing some testing guidance about who should be testing. I mean, you want to test in order to get a clinical outcome, and that has got to be readily available for anybody, particularly our vulnerable populations who are infected. But I think what you're seeing is there's people who go to the drugstore, they'll buy all these tests, they'll go multiple times a week and go to the sites and test without symptoms. That is just going to contribute to some of the crunch that you're seeing. So he's going to work on putting out some guidance to try to say, let's test for a reason, and if you need the treatment, obviously we want the treatment to be there for you, and I think that that'll be something that'll be very well received. So we are ready to go on all this and have been ready for a long time. We do not believe that the federal government should be holding back any more medications. We think we have to offer this, particularly for our elderly population. If you look at Omicron and the profile that we're seeing in terms of the clinical outcomes, it's always been true with COVID that the younger folks were less risk, but I think that's even more true with what we're seeing with Omicron. And it's just like other respiratory viruses. You know, elderly people are just going to be more, people that have health problems are going to be more at risk from any type of respiratory infection. I think that's what we're seeing with Omicron. So we really want to focus and make sure, and Simone is going to talk a little bit, you know, if you have an outbreak in a nursing home, we are going to send the teams in there to go with the monoclonals, with whatever we can do to be able to help alleviate that situation. And those are the folks that are going to be most at risk on this. The other thing that we're looking at doing, and it's not, the technology isn't where we would want it to be like it would be for, say, distinguishing between influenza strands, but you can sequence these test results to try to figure out if it's Omicron or if it's Delta. When they do the estimates about South Florida, 90+% in Miami, you know, they're taking a subset, they're running that through, and then they're extrapolating out to the whole county. So we think it would be something that if you could turn it around quick enough, if you do have a patient who is high risk, but they're not necessarily showing significant symptoms, if you could get it in a decent time, then maybe you know, okay, it's Omicron. Maybe we will focus on the sotrovimab. If it's Delta, well then we'll do the Regeneron or however the practitioners think makes the most sense. But we do not have the technology right now to where you get tested and then you can determine right immediately whether it is Delta or whether it is Omicron. We would need to sequence that. That takes a little more time, a little bit more manpower, but it's something I've asked Dr. Ladapo to look at, bringing together with some of our treatment sites so that we can focus treatments the best way that we can. But we are ready to go. We're ready to receive, and we will put all of this to good use. You can bet your bottom dollar on that. And to expound upon some of the treatments as well as the testing, I have Dr. Ladapo is going to come up and say a few things. Yep.
Good morning or good afternoon. I always have to check these days. Okay, I'm a dad of 3 kids, so, you know, give me a break. Completely agree, of course, with what the governor has shared about the epidemiology of Omicron in Florida so far and the plan regarding treatment and testing. So just to reiterate the highlights, so, you know, everyone knows Omicron is spreading extremely rapidly. The good news is that it appears to be less virulent, and the hospitalizations are not increasing nearly at the rate that the cases. It's not close. There's a very big difference between the change in cases and the change in hospitalizations. So that's really welcome news. You know, that's really great news. And then something else the governor has noted is that there's a distinction between the people who are being hospitalized with COVID, with Omicron right now, and the people who are being hospitalized for COVID, for Omicron. So that's a very big deal. There's a big gap right now. The estimates I've seen, like the governor, are that maybe half of people on average, there's a range, but half of people are just in the hospital for something else. And that's actually reflected in our ICU numbers. So we're not seeing any big increase in our ICU usage. So that's all really good news. You know, it's a blessing considering how the last 2 years have been. So in terms of treatment, you know, fortunately my department and the governor's office were able to work together to put together an effective communication last week to reverse the completely senseless decision that the federal government made to withhold effective treatment from populations during a surge. So, you know, you didn't need, you know, I have an MD and a PhD, but you didn't need either one of them to figure out that that wasn't the right decision. And unfortunately, the federal government has reversed on that. So that's also good news for Florida and good news for the rest of the nation. In terms of the newer treatments, we're seeing more of the Paxil and the Merck products reaching pharmacies in Florida. So we're working with the federal government, we're working with pharmacies and other sites in Florida to get that out in the community. I think in other areas where the demand is outstripping supply, particularly for high-risk patients. I think, clinicians, and we've encouraged clinicians in our communications to consider the clinical evidence for other medications that people can take at home. So, for example, there's high quality data on inhaled budesonide, that's reductions in hospitalizations. And fluvoxamine is another medication. There have been 2 randomized clinical trials that have been published in very good journals that have shown a benefit up to a 90% reduction in hospitalizations and death among people who were adherent to treatment in the fluvoxamine trial. Really great results. You don't hear about it because it's, Pfizer doesn't own it, Merck doesn't own it. There's no one to share that amazing news with people. But really great results and options for clinicians, particularly when there's a crunch on monoclonal antibodies and you're in the middle of a surge and you have a high-risk patient. And then, as the governor mentioned, we're working on testing. So my department's goal is going to be to put out testing that doesn't restrict access to testing, but reduces the use of low-value testing and prioritizes high-value testing. And what do we mean by that? So high-value testing is testing that's likely to change outcomes, right? So, if your grandmother gets a test, that's a much more valuable test than the 8-year-old, third graders that Los Angeles County is sending in to get weekly testing, right? The first one's is much more likely to change outcomes. So we're going to be putting out guidance that puts more emphasis on that. And we're going to be working to unwind the sort of testing psychology that our federal leadership has managed to, unfortunately, get most of the country in over the last 2 years. We need to unwind this testing sort of planning and living one's life around testing. Without it, we're going to be sort of stuck in the same cycle. So, it's really time for people to be living, to make the decisions they want regarding vaccination, to enjoy the fact that many people have natural immunity, and to unwind this, this preoccupation with only COVID as determining the boundaries and constraints and possibilities of life. And we're going to start that in Florida. Okay, thanks. Oh, yeah, absolutely.
Talk about how initially can you explain why it was that they said the Regeneron may not work? Like, was that a clinical trial, or what was that in terms of Omicron?
Oh, sure. Yeah, absolutely. So what it was sort of a terrible clinical decision, and I think it actually highlights the fact that that the leadership of HHS doesn't have a clinical background. I think that's actually what that decision reflects. So the laboratory evidence was indicating that the affinity of the antibodies, such as the Regeneron antibodies, for the Omicron variant were diminished. And, so it seems that it's likely to not have the same effectiveness as it did previously. But that's not the same thing as concluding that the Regeneron antibodies, monoclonal antibodies, will not work in a patient with Omicron. So there's a difference between laboratory data and clinical data. And they made the decision to withhold the medication based on laboratory data, but we care about clinical outcomes, and the decision should be based, obviously, on clinical data, which is why they've reversed it.
And we, a lot of Floridians, we had August, September, and we did probably 160,000. We definitely kept tens of thousands of people out of hospital who got this early, saved lives with it. People were really happy. They resolved their symptoms. But we also had very good response when we did introduce the sotrovimab. And that's IV, so it wasn't as easy to do as the subcutaneous. But that worked well, and hopefully it continues to work well with Omicron. There seems to be high confidence that it is. But I think all of them, we've seen some levels of success. And so at the end of the day, if the Regeneron was X% against Delta, pretty high, if it's half that, that's still better than not getting anything. Why would you want it to sit on a shelf if it has, 50% chance of keeping someone out of a hospital? And it may turn out, who knows how it'll end up turning out once you get clinical data. But I think it was kind of just like reported like, oh, it definitely doesn't work against that. And I asked, I was like, it doesn't, we know that? Did they already run that or something? And it was, there was this little data point, but this was not something that was born out of a full-blown clinical trial. Okay, Director Kevin Guthrie from DEM.
Thank you, Governor. Thank you for having me here today, Shane. Appreciate you being here and the other elected officials. As you've seen, Governor DeSantis has been very instrumental in securing the life-saving treatments that we've been rolling out over the last several months. We're ready at the division to continue rolling that out. Under his leadership, the division has remained prepared to support the continued operation and administration of these treatments done by the Florida Department of Health and, in certain cases, ACA when it comes to ALFs and nursing homes. We took multiple steps, including securing nearly $1 billion, as the governor's already mentioned. We went, along with the Office of Policy and Budget, we went to the Legislative Budget Commission and secured that additional nearly $1 billion so that we are ready to go. We saw this coming. We saw and we were prepared for what might happen. In most cases, if we should get these therapies, we can immediately, and when I say immediately, within 24 hours, open a site. Some cases it may take us 48 hours, such as the situation right now in Central Florida where we've identified a site, but we're still working through the contracts with that particular company. But again, as the governor said, we are locked and loaded and ready to go. As I mentioned before, this is not new to us. The Division of Emergency Management's been involved in this fight along our partners at the Florida Department of Health, ACA, our local county EM directors, for the last 2 years. We can perform quickly. We are built for speed, and that's what we do as we respond in the time of need. We know that this is a very important life-saving treatment. Again, Governor, we appreciate your leadership on this and taking an active part in trying to get out there because early treatment does save lives. Thank you, sir.
Great. Okay, ACA Secretary Simone Marsteller.
Thank you, Governor. I think it is still morning, so good morning, everyone. I do want to pick up on the point that the Governor made about making sure that our seniors and most vulnerable residents in our long-term care facilities have access to vaccines, boosters, and most importantly, monoclonal treatments. As I'm sure you all know, Governor DeSantis' Seniors First strategy in the very beginning days of COVID went a long way towards saving so many lives of our seniors and other vulnerable individuals in our long-term care facilities. That Seniors First strategy still exists. Hopefully we will get some additional supplies of MAB, but even right now for those facilities who either do not have a relationship with a long-term care facility or otherwise need assistance in getting their residents the treatment that they need, the Department of Health, working with the Agency for Healthcare Administration, can send individuals in, strike teams as needed, to give those individuals the treatment and the vaccines and or boosters if they so choose. So I'm grateful, Governor, that you are pushing and have pushed and frankly shamed the federal government into letting go of these very important life-saving supplies. You have also heard the Governor mention hospitalizations. I just want to pick up just briefly on that. So as of today, our COVID-19 hospitalizations have decreased 68.91% since the most recent peak on August 18th. As of today, our COVID-19 ICU bed utilization has decreased 84.2% since the most recent peak on August 24th. That is good news, ladies and gentlemen. That is good news. Finally, the Governor did mention the importance, and I agree with him, of hospitals delineating between those individuals who are hospitalized for COVID, or I should say because of COVID, and those individuals who have COVID coincidental to whatever the primary reason that they are being admitted to the hospital. My agency is going to be working with all our Florida hospitals to collect that information, because I agree with the governor, it is important for us to have that information and to get the information out to the Florida public. We don't want people to be afraid. We want people to make the right decisions, but we also want them to have the right information on which to make those decisions. So I thank you, Governor, for your leadership, and my agency stands ready to assist as needed.
And if you look at the overall capacity, I mean, I think the hospitals in Florida have done a very good job of managing and expanding when need be. There's a lot of capacity available right now. Of course, we have a lot of people in Florida over these months. As many of you know, I mean, we probably, on any given day, will be about 25 million people when you think of the tourists and all the snowbirds and everyone down here. And so they have the ability to do that. And so we've got a lot of capacity. I mean, I think that we worked very hard a couple months ago to protect the nurses from being fired, and I'm not saying here they would have done that, but some of these places that did that are now ruining the day because they're looking and then they may not have enough people. And so we thought it was very important to make sure that our healthcare workers would be able to have jobs, but also it's better for the healthcare system that you're at full capacity, and so be able to do it. We also, and it ties into long-term care because there's a lot of folks in long-term care who are interested. Right before Christmas, Dr. Latipo and I announced that Florida would be offering the new Evusheld product by AstraZeneca. So that is it's different from the treatments that we're talking about here for people who are infected. It's non-exposed, non-infected people, mostly elderly and immunocompromised is who it's for. And you take it, and the trials have shown 6 months of protection going forward. And so that's something that Florida Health, COVID19.gov, if you go on, we have the different sites. We've tried to put it out. Again, we get a limited supply from the federal government. So whatever they give, we try to send it to places so that Floridians have access to it. Obviously, some of the rural areas, you're going to have to drive a little further than in Broward, but we try to do it so it's good. So we don't know exactly. It's going to take a little bit more time to figure out how effective that's been, but if it's in line with the clinical results, that's going to end up preventing a lot of Omicron, but maybe even some Delta infections in a very vulnerable population. And so that's something that is also in the mix as well. Okay, I have now CEO Shane Strum.
All right. Good morning. Welcome back, Governor. It's good to have you here at Broward Health. First, Happy New Year. I would say Broward Health wishes are a healthier 2022. So, great. Well, we're excited to have the governor here. This is what leadership looks like. Those on the stage with me, if you look at it, you have the governor, you have 3 agency heads, 3 members of the House of Representatives, and the mayor of Broward County. That's what it's about. They've been here from day one. I can take it back a few months when we were worried about the Delta variant and we needed monoclonals desperately. The first person to step up to the plate and the first call that we made was to Governor DeSantis, and he made sure that we were able to have those. And a lot of that happens also when you have a strong board. Governor, this board has made sure that we were able to help the community every turn and every twist that we've made, whether it's monoclonals, vaccines, or tests. So we're excited that you're here. We have a lot more things that we're going to be doing, but any of the additional help you can get with the Regeneron or the other drugs are very helpful. So thank you.
Absolutely. Okay, we have Chief Medical Officer, Broward Health, Dr. Joshua Lenchis.
Well, thank you very much. For almost 2 years, the caregivers here at Broward Health, physicians, nurses, technicians, and therapists, thousands of others have cared for folks battling COVID-19. In fact, the first vaccinations in Florida, as you recall, in Tampa, I saw the picture last night, December 14th of 2020. Here at Broward Health, a few days after that, but last year at this time, a month later, the caregivers here began administering those monoclonal antibodies. The first one was bamlanivimab. In support of the clinical literature, at the time, we too witnessed the safety and effectiveness when administered to those who were infected with COVID-19 who did not require hospitalization. I'll reiterate that the governor said the monoclonal antibodies as a viable treatment option to help keep patients from progressing to severe illness and keeping them out of the hospital. While the variations and the combinations used have changed over that time frame, depending on the COVID-19 variant we faced, The data continues to underscore the incredible effectiveness of these medications. And while, as the governor mentioned, there's some recent study that's looking at the effectiveness of the currently used monoclonal antibodies on the Omicron variant, the fact remains that the Omicron variant, as he said, was not the only variant that's out there. So I think that the fact that Delta continues to have a formidable presence in Florida, that it's important that we reiterate the need to continue to ask for the monoclonal antibody. These physicians that are working here on the front lines, as well as others around the region, need these treatments, and the oral medications that we discussed that are approved under emergency use authorization to continue to care for our patients and ensure that health systems can meet the demand for the COVID-19. Thank you, sir.
All right. Okay, the mayor, where is he? All right, come on up.
Good morning. Thank you, Governor. Thank you, CEO Shane Strum and the entire board at the Broward Hospital District and all our medical healthcare workers who are on the front line day in and day out helping Broward County residents and Floridians through this battle. As the governor mentioned and as Director Guthrie mentioned, Broward County is ready to stand up additional sites within 24 hours as far as MAB treatments. We have a site picked out, ready to go, the logistics are done, and we're ready to open that site within 24 hours. We continue to work with the Department of Health and all state agencies to provide additional testing resources to our residents. We're working the logistics, we're opening those sites pretty much on a daily basis, opening more and more to meet the demand of the public. But I agree that we need to come up with some reasonable, rational testing requirements so that we're not overstripping and creating a demand situation that nobody could reasonably keep up with. So I urge residents to take that into account as they decide whether to test or not and look into those things. Vaccines, boosters, we're working with ACA and we're working with our senior communities when we have that to go right into the communities to help our most vulnerable, and Broward County will continue to do that. So I thank you for your cooperation and all the department heads for working together with Broward County so that we can ensure the best health outcomes for our residents and visitors. Thank you.
I think it's also just important to point out in terms of Florida. You look what's going on in other states. They're letting hysteria drive them to doing really damaging things. We thought that people had learned. They're closing schools. They're doing things that should not be done, and that is not the way you deal with this. And so, we are 100% committed to making sure that people are able to live their lives, that our kids are able to get an education, that people's businesses are able to operate, and that people have jobs. And so that is just non-negotiable, and you got to do it. And when Joe Latipo first came on board in September, he said that there's no place for fear when you're doing the policy. You got to deal with this rationally. I think that particularly given the clinical profile so far of Omicron, there's not justifiable to let fear overwhelm you. I mean, this is something where, we're seeing dramatically less clinical results, negative clinical results compared to what we saw with Delta. It doesn't mean that we don't want to do all we can to help the people who need the help, and that's why we're doing this. That's why we set aside so much money. That's why we've mobilized and done all the things we do, and we'll continue to do more as the federal government empowers us to be able to do it. But man, you can't let go down that road, because that is a road they're just never going to be able to get out of that rut, and it's just going to continue to hurt a lot of people, and it ain't going to do anything, to slow down or to stop a incredibly contagious airborne virus. I mean, come on. And so we're going to be there for folks. We're going to make sure. But as Joe Latipo said, that's across the board. Kids that are in school thriving means a healthier community. People that can put food on the table means healthier families. And so we're not going to waver on that. We were, my wife and I were able to come down on New Year's Eve, go visit Hard Rock Stadium. People were having a good time, and they were living their lives. And so we've got to continue to do that, and you can't let any type of hysteria undercut the normal functioning of society. Okay, with that, yes, sir.
Governor, you mentioned your wife being say how your wife is doing, how she's responding to treatments. And second, what do you make of this the hysteria regarding your so-called vacation this past week and your being MIA? Can you speak to that?
Yeah, I mean, I guess I should have been at the beach in Delaware, right? And then they would have been really happy with that. You know, it was, I mean, you look, we actually put out the schedule, and I think these people didn't know that. They think because you're not doing a big press conference, you're not doing. So, you know, Friday we were, Kevin, Joe, and I all had discussions about, you know, doing what we're doing. Of course, I was at the, down in Miami later, Thursday in the office working on this and some other stuff. And it's true, Wednesday there was nothing on the calendar. And so I think they're like, oh my God, he's on vacation. And I'm like, you know, and I just looked at my wife, I'm like, you know, going to the hospital with you is not a vacation for you. I know that. And it's not a vacation. I mean, this is something that as a husband, I think that I should be doing. I've accompanied her to all her chemotherapy treatments, and she's there for a long time. I mean, you know, I'm there most of the time, but it's a draining thing. When she's done with it, you know, it's not something that's great to see. And so I just think a lot of people, particularly people that have gone through breast cancer treatments, the notion that that would be considered a vacation, I think is offensive to a lot of those folks, and they understand, you know, what you're doing. At the same time, she's committed to not being in the fetal position the whole time. And, you know, she's not through with it, but she's almost through with it. And I think she's going to end up good on the other end of it. But that's just, you know, the way she is. And so, yeah, I think it was dumb. There was a foot fault, obviously, on their part. It wasn't effective. And all I can tell you is that, you know, sometimes, you know, we just try to get this stuff done. I mean, I don't care. I mean, we don't do political. We just want to help people with this. But, you know, when you're in a political arena, sometimes you're fortunate in the enemies that you have, because, you know, these are folks that are just not shooting straight right now.
Governor, what is your advice to, like, school districts who post resuming classes today? What do you tell families? What's your message with this?
Our schools will be open in the state of Florida. This is not, first of all, if you look at the data that's been amassed throughout the pandemic, it's found that you have worse outcomes by closing schools in terms of whatever community prevalence is. The schools are not driving this. We know that. We know 100% that's true. And so it'd be so damaging not to do that. So kids need to be in school. They do not need to be doing any crazy mitigation. Just let them be kids. I think it's pretty clear a lot of this mitigation, it hasn't worked, period. But for Omicron, I mean, just think a lot of the places that have had massive surges recently have vaccine passports, have mandates, have restrictions, have a lot of that stuff, and yet this thing just kind of blows right through it. And so they need to be in school. Parents need to be assured that they're going to be able to send their kids to school. One of the best things that we did this school year with Dr. Latipo was get rid of healthy quarantining of kids, where you'd have one person test positive and you'd send healthy kids home, and almost none of them would end up testing positive themselves. So they were kept out of school for so long, and that was bad policy by CDC. With Joe, we revised that and said, actually, if you're symptomatic, send home, but if you're healthy, you need to be in school. And that is our policy. We think that flows out of the rights of parents to have their kids educated, and we're not going to deviate on that. And the places that are closing schools, if you look at some of those states that are doing it, the communities that they're doing it in are mostly affecting working class and low income and poor kids. That's who it's affecting. Those are the folks that are least able to bear the burdens of some of this mitigation, and yet that's what's happening. So that's the wrong approach. In Florida, you know, we absolutely want the kids in school, and we know the data has been very clear for a long time that whenever there's any type of wave, it's not the schools that are driving the wave. In fact, the Delta wave in the South was a great example. We brought the schools in just as this thing was peaking, and basically it totally crashed and went down for 3 months. And then when we've seen Omicron take off, the schools were largely adjourned for Christmas break when we saw that. And so there's not a correlation there. But I'd also say the same thing with our state universities. You're seeing some of these other universities around the country, some of them are even doing shelter in place over Omicron for what, a 20-year-old college student? I mean, it's absolutely insane what's going on. our universities are going to be open, our state universities. They're going to have in-person instruction. And I think any university that doesn't do that should have to refund 100% of the tuition to the parents.
Local school district officials have criticized the ban on mask mandates. They say it's tying their hands, preventing them from enacting rules that would have been shown to protect students. Whatever happened to home rule on that issue, and why should it be left up?
Florida has a Parents' Bill of Rights in the state, and which says that politicians don't get to countermand the rights of parents. That means parents have primary responsibility for the health, education, upbringing of their kids, and forcing kids to wear a mask for 8 hours a day is something that most parents, many parents, do not want. We, of course, give parents the option if you think that that's something that's good. But I would note, they're even saying now, I mean, you even see some of these TV doctors on CNN admitting the cloth masks are not going to protect against Omicron. This is an aerosolized pathogen. It's airborne. And so if you have a piece of cloth, it's not going to protect. The thought of the cloth was if it was primarily through respiratory droplets. So we're going to let parents make those decisions. I think it's absolutely the case that the places that did real stringent mitigation in schools last year in Florida saw some of the biggest declines in performance. Broward led the state in decline. And I think they need to have a normal environment. I think they have the right to breathe. I think they need to do that. And we can't go backwards with some of this stuff that has not proven to be effective. And that's the thing. You know, you'd have the ability to do randomized clinical trials to show effectiveness. Instead, they always do these other things which are easy to debunk very quickly. It does get headlines because it fits the narrative, but it's not ultimately really sound science. And so let the kids learn, make sure that they're there. But let's just be honest with people about when you have something that's this widespread, that is airborne, simply putting cloth over and thinking that somehow that is going to provide good protection. That's just not accurate. Almost everyone now Fauci will not admit that. He said it's still effective against Omicron. I don't know how he would know that, but that's what he said. But even a lot of these other folks that you see who were big proponents of this for a long time are acknowledging that with Omicron, this is not something. You're free to do it, and it's up to you, but let's not try to tell that putting it on kids is going to make some type of big difference here. Yes, sir.
AOC was seen regarding mask does. You're here for that. She's been critical of your policy, but yet she comes to Florida and enjoys the free state. Can you tell me a little bit about that?
Well, I mean, look, I think if I had $1 for every lockdown politician who decided to escape to Florida over the last 2 years, I'd be a pretty doggone wealthy man, let me tell you. I mean, Congress people, mayors, governors, I mean, you name it. And it's interesting, though, the reception that, you know, that some of these folks will get in Florida, because I think a lot of Floridians say, wait a minute, you're bashing us because we're not doing your draconian policies, and yet we're the first place you want to flee to basically to be able to enjoy life. And so I'm not surprised to see that continue to happen. I could tell you, I mean, you know, there are probably about a half dozen governors who had restrictions on their people and then were spotted at various points in Florida. Some of it's been public, some of it's not been public, but you know, people tell me these things, and so these things are spotted, and so that's just the reality that we're dealing with. I think I'm happy, though, that Florida's a place where people know they can come and they can live like normal people. They can make their own decisions. You know, Fauci, again, he's railing against the restaurants. I mean, these poor people have had, I mean, they've done very well in Florida because we protected them. But, I mean, this is not an industry that's easy to do very well in. And he's singling them out as if that is somehow such a huge factor when there's all these other things that you could be pointing to. You know, I just think it's wrong. But people know they can come, they can go get a beer. They're not going to have to show papers. They're not going to have to do anything. And just look at what we're seeing now. How big of a failure have vaccine passports been? Okay, if vaccine passports succeeded, you would not see a lot of the stuff that you're seeing in a lot of states that implemented them. And so all it served to do was discriminate against people based on an individual choice, create a two-tiered society. And yes, they are moving, like I said a couple months ago, they are moving to update that to say in some parts they're going to say you need a third shot to be able to do. So, so those policies have not worked, and I think ultimately, look, people vote with their feet. I always say I'm so happy with our Floridians. I'm not asking for people to come move, because we've got great people, we've got a lot of great stuff going on. I think we're going to do a lot more great stuff. But the fact of the matter is, you know, if you look from July of 2020 to July of 2021, we led the country in where people were wanting to come to. And I think that that's a result of protecting people's freedoms and making sure that we had a state worth living in.
Governor, given that there's a limited supply of the monoclonal antibodies, is there any thought being given by you or the Surgeon General to lifting the standing order and allowing doctors themselves to prescribe them and determine whether people really need them or not?
So here's the, I mean, it's a good question, because prior to what Florida did, you had to go get basically a prescription from a physician, which is fine generally, just, you know, as you know, in theory. The problem is, you know, okay, how long does it take you to get in to see your doctor? When can you get the script? How long that? And when you talk about early treatment really making a difference, you know, if you do it on day 5, that's going to be better than on day 11. And so what we did with the standing order was kind of cut out the middleman, let people go in directly, and if they qualified under the EUA, they would get it. That resulted, I think, in people getting it early enough to make a bigger difference than if they had that additional red tape. However, the result was you would have people that would come, and there were people, no doubt, who got the treatments who likely would have recovered without the treatments. I mean, that's for sure. So the question is, do you reinstitute having them go through physicians, or do you do a standing order, maybe emphasizing a more targeted group of folks to qualify under the standing order? Joe's going to have some guidance on that, but I think where we're going is we're going to continue with the standing order, but I do think it's going to be explicitly targeted, particularly when you have Omicron. Not that young people were particularly vulnerable to the other strands, but this is one where you're basically cold-like symptoms for a lot of those folks. That is not something you need to be coming in, you know, to get monoclonals for. So let's look at our elderly population. Let's look at folks that are immunocompromised, maybe things like diabetes that have shown to be real serious risk factors, and focus it on there. I'm confident that if we do that, you'll be able to still get people in early enough, and if the federal government honors our request for these 30,000 additional doses, I think we're going to be able to meet the demand. You know, Shane here, they could do more if they had more supply, and so we want our hospitals to be able to do more. One of the things we did after the summer and we came down off the Delta was say, okay, we're running these 25 sites, that's great, but we have healthcare apparatus. Let's get them more involved. And here in Broward, they really took it, and other parts did it, and so we're proud of that. But now at the same time, we have an opportunity to expand, and we want to do that. But yes, it is going to be tailored to the folks that need it the most. I just think that especially with Omicron, where Dr. Latipo said, I mean, if you look at Simone cited the hospitalization numbers, let's say it's 50%, let's say it's 40% are there with, not because of COVID. You know, that's a far, far fewer number of people hospitalized than we've had in our previous waves at this point. So we just have to understand who's most likely with Omicron to be hospitalized, the elderly, and really focus the treatment on that accordingly. Okay, guys, thanks so much. Appreciate it.